Good morning. My name is Leslie O'Reilly, and I am Chair of Eastern Health's Board of Trustees. It is my sincere pleasure to be your MC for today and to welcome you to our annual general meeting. And today, as we open the annual general meeting, I want to present some highlights and update you on the developments and changes that we have seen during the fiscal year April 1, 2018 to March 31st, 2019. Today we are broadcasting our AGM live to our employees and physicians via way of Microsoft Teams. For those here in person, please be advised that this session has been recorded for those who could not join us today. First, I would like to introduce you to our head table. On my far right is Heather Hanrahan. Heather is Assistant Deputy Minister of Regional Services with the Department of Health and Community Services. And Heather will be, I'll be introducing Heather a little later. Dr. Peter Ford is a board trustee, and he is a member of our Finance Committee. And in the absence of our chair of our Finance Committee this morning, Peter will be delivering our Finance Committee report. And next, right to my immediate right, is David Diamond, and David is President and CEO of Eastern Health. I would also like to recognize my colleagues from our Board of Trustees and ask that each trustee please stand and be acknowledged. Tara Lang. Hi, Tara, great to see you. Over the wet road this morning. Dr. Marilyn Thompson. Peter, Dr. Peter Ford, I just introduced. Sister Sheila O'Day. Sheila. Lynn Wade. And Amanda Cull. Good to see you, Amanda. Really happy to see you, going through your physical challenges with those broken wrists and so forth. Jim Miller. See you, Jim. And we have regrets from a number of our board of trustees, Alistair O'Reilly. We have Sharon could not make it, and Marilyn Butland could not make it this morning, and for a number of other reasons. Wish to be here, but they couldn't be in attendance. Bob Andrews, our vice chair, also could not make it. Our Board of Trustees includes a group of volunteers from communities throughout the Eastern region. Each one of these individuals is dedicated to ensuring high quality care for patients, clients, and residents. I really want to thank them publicly for the commitment they have given to the organization over the past year. I know there are some people here who have experienced. Frank Davis is a past trustee of our board, and Frank is it's people like him who have given so much to healthcare over their last number of years that you can appreciate the time and commitment that's given by trustees and dedicate their whole thinking when they are at our meetings or preparing for meetings in support of patient care and patient safety. Next, I warmly welcome representatives from our health foundations and auxiliaries who may be joining us today. I cannot thank you enough for the work you do to help our patients, families, and entire organizations. Thank you, of course, especially to the donors who give so much to our foundations, and the valuable volunteers and partners in supporting Eastern Health through your generosity and giving within our communities. And to the members of our executive team, thank you for your leadership and your role in ensuring that our patients and families across the province are receiving quality care services. And of course, I warmly welcome Eastern Health employees, physicians, and volunteers. I extend my gratitude to all of you for the extraordinary contribution that you have made over the past year. Last but not least, I welcome members of the public, community partners, and members of the media who have joined us today. Thank you for coming. We have made a special effort, of course, we have over the last year to take our meetings outside of St. John's, our core center, and to reach out to our communities on the Burin Peninsula, Bonavista, knowing that we have responsibility for healthcare for all services basically east of Port Blandford. So we have a big organization with huge responsibilities. And we try to get out to the communities with our meetings so that we give the members of the public and communities an opportunity to participate, to engage. And so today, following our annual meeting, we will actually have meetings and presentations and luncheon with members of the community and this region, and give them an opportunity to really share their thoughts and concerns and issues and overall overview of their thinking on the services that Eastern Health provides in the region. Without any further delay, then I would now like to invite Ms. Heather Hanrahan to the podium to bring greetings and best wishes, of course, on behalf of the department. And we work very, very closely with the Department of Health and Community Services. I mean, it's a family network, really, when you think of bringing healthcare services to our regions and to our patients and families, and working together with our physicians and our staff, and having the department been working closely with us is really, really important to the work that we do. So Heather, we really thank you for coming this morning on behalf of your department. So would you appreciate your bringing greetings on behalf of the department. Please join me in welcoming Heather.
Thank you, Mr. O'Reilly. I'm delighted to be here today to bring greetings on behalf of the department. Unfortunately, the minister had a prior commitment. He's in Labrador today, and he was there yesterday as well. I'm particularly excited to be here as I started my health career at the GB Cross Hospital here in Clarenville and worked with Eastern and predecessor organizations for over 20 years. So it does still feel like coming home, and there's a lot of familiar faces in the group, certainly. I look at the annual meeting as a time to step above, the day-to-day grind we always find ourselves in, and to take stock of the many accomplishments. And certainly there are many. While our department sets the overall strategic directions and priorities for the healthcare system, the 4 regional health authorities are directly responsible for the delivery and administration for health services within their respective geographic areas. While we recognize and appreciate the leadership of Eastern Health in operating the largest integrated health authority, providing a full continuum of health and community services, including public health, long-term care, and acute care. We recognize that Eastern not only provides quality services to the clients, patients, and region of the Eastern region, but also the full province of Newfoundland and Labrador. While we appreciate all services offered by Eastern Health, just particularly like to mention the tertiary level services provided in areas such as cancer care, cardiac and critical care, children and women's health, diagnostic imaging, laboratory services, mental health and addictions, rehab, and surgery. Health and community services strategic directions are guided by the triple aim approach, which implies that better care, better value, and better outcomes is our goal for the future. This aligns with the priority areas of Eastern Health, which include access, quality and safety, population health, healthy workplace, and sustainability. I'd like to acknowledge a few successes in these priority areas. Access. Note your commitment to access and acknowledge improvements, particularly in the areas of mental health and addictions, which have been successful through initiatives such as e-health options, including Strongest Families, as well as expansion of doorways, single session walk-in counseling sessions. I also like to note improved access to primary health care has resulted in decreased emissions of ambulatory care sensitive conditions, and this is supported through initiatives such as remote patient monitoring, which enables the management of patients in their home, which aligns with government's Home First initiative. Quality and safety. In terms of quality and safety, we acknowledge Eastern Health's effort to create an environment that fosters client and family-centered care. We acknowledge Eastern Health's efforts to engage and get feedback from clients and families, including the use of client and family advisors. Quality is reflected in the hospital standardized mortality ratio, which is an indicator which measures death in hospitals. I am delighted to see continued improvements to the rate with a 13% decrease since 2016-17. Population health. We acknowledge Eastern Health's overall commitment to improving population health. We note improvements to the breastfeeding rate, decreased smoking by pregnant women and new moms, increased participation in Newfoundland colon cancer screening programs, and increased organ donation. Healthy workplace. Certainly all employees and physicians are important in the delivery of care, and we note the improved engagement survey reports in your annual report, as well as a decrease in sick leave rates, which are a huge cost in the healthcare system. Finally, sustainability. As healthcare costs increase, we recognize Eastern Health's efforts to ensure a sustainable healthcare system through initiatives such as reducing no-show rates in selected areas and decreasing length of stay in acute care. Overall, we recognize that there's been financial challenges within the current economic environment, and we appreciate the work of Eastern Health to achieve expenditure reductions at the same time to provide quality care to patients, clients, and residents. Our department looks forward to working with Eastern Health as you work towards your vision of healthy people, healthy communities, and we are appreciative of the great relationships with Eastern Health, and we look forward to continue to work together to foster future relationships. All the success with your annual general meeting and all the best for the upcoming year. Thank you.
Thank you very, very much, Heather. We really appreciate your thoughts and your summary of some of the achievements of Eastern Health over the past year. And I was in following through and following up on your comments. I just want to touch base and say that it's part of my job here today to kind of share some information and context in terms of the complexity of the work of Eastern Health. I noted earlier that we have responsibility as a corporation for health services inside of on the east side of Port Blandford, and it's an organization of approximately 13,000 people, but you not only see the reach of Eastern Health inside the organizations that we frequent and many occasions throughout the year to our acute care, but also that we do have responsibilities for tertiary care across the province and the island and in Labrador. So I just want to share, I guess, a few thoughts on what our lines of business are, just again filling and building on the comments that Heather just noted. We are responsible for promoting health and well-being. This involves healthy lifestyles, preventing disease and injury, as well as carrying out initiatives to help protect the health of the public. Another line of business is treating illness, and that's probably the one that most of us come in contact with. And that refers to acute care. It's hospitals. It encompasses healthcare facilities throughout the region, community health centers, regional hospitals, tertiary hospitals, rehabilitation, cancer care, mental health and addictions, and numerous other programs and specialty and services. I think it just points out the everyday. There's no organization that would be faced with more risk areas than healthcare every day, right now. I mean, people are ill when they go to hospitals, so there are risk areas, and we want to really accentuate the whole thinking that the responsibilities of our staff to really be reaching out, to really be sensitive to these areas is big part of our mission. The third line of business is providing supportive care. Entails a wide range of services, including community supports for people who live with developmental challenges, and providing residential care, such as long-term care. And in this province, we know the real challenges that's going to be coming, are here, and it's coming and continuing to grow in long-term care. As our demographics point out, and we at Eastern Health are very cognizant of those challenges, and as we explore the challenges with the department and in other RHAs, it's an ongoing set of circumstances that we cannot walk away from. We must face it. And so long-term care and patient care, and as our population is aging, it's certainly very, very close to our everyday undertakings. Lastly, we are responsible for advancing knowledge. It includes research and educating the next generation of healthcare professionals in our teaching and learning facilities. We have agreements with about 40 educational institutions, and we provide a wide range of student placements throughout our organization, including nursing, allied health, medicine, laboratory, business administration, and many others. In this province, we are fully aware of the challenges of attracting young people into healthcare, and the sector and the new career opportunities within healthcare and the challenges within healthcare. And in this province where we are faced with an out migration to some degree, or probably to a significant degree, we in Eastern Health are putting extra emphasis on trying to find new ways that we can play a more active role, if you want to, in finding careers in healthcare that will be attractive and cause our young people to start looking at more opportunities within healthcare, but because we know that's a growing and urgent need. I would now like to move on and ask Peter, Dr. Peter Ford, if you would, Peter, come forward and bring us an update on our. You got 2 minutes? Oh, I'm sorry. For the minutes of the meeting, yes. Okay, I didn't follow my notes closely enough. When I get carried away on something I really believe in, it's very difficult. We have the minutes of the last annual meeting. Do I have a mover, Marilyn? Do I have a seconder? Lynn? It's been moved and seconded that minutes of our last annual general meeting on September 27, 2018, held in St. John's, be adopted. On the question, all those in favor? Country-minded, motion is carried. So now, Peter, I'm anxious to hear you talk about finance. So if you would, please, thanks very, very much for keeping me on the agenda also.
Thank you and good morning, everyone. Mr. O'Reilly, Mr. Diamond, fellow board members, invited guests and staff, I am pleased to present for adoption at this annual general meeting the financial statements for Eastern Regional Health Authority for the fiscal year ending March 31st, 2019. These financial statements have been audited by the firm of Ernst & Young, LLP, and I'm pleased to report that the auditors have expressed an unqualified opinion on these statements. Eastern Health has 12,636 employees and 696 physicians, of which 241 are salaried positions. For the fiscal year 2018-2019, Eastern Health's cash-based operating expenses were $1.595 billion, of which 76%, or approximately $1.22 billion, was spent on direct patient care. The other areas of expenditure included support, administration, research, and education. A detailed breakdown of Eastern Health's finances can be found in the operating revenues and expenditure section of our annual report. During the fiscal year, Eastern Health incurred an operating cash deficit of $17.8 million, inclusive of total one-time funding received from government in the amount of $16.2 million. A year-end total accrual surplus was realized during fiscal 2018-2019 of $55.8 million, primarily due to the reduction of a severance liability associated with collective agreement terms and conditions. As a result, this surplus amount was applied towards the reduction of the health authority's accumulated deficit. The financial statements are included in the annual performance report distributed here this morning. I would like to take this opportunity to thank the members of the Finance Committee and the Board of Trustees for their support and commitment during the year in overseeing the finances of Eastern Health, as well as the President and CEO, his executive and staff for their work and dedication. Mr. O'Reilly, I move the adoption of the audited financial statements for the Eastern Regional Health Authority for the fiscal year ending March 31st, 2019. Mr. O'Reilly, my second duty this morning is to move the appointment of the authority's auditors. And I would move the appointment of the firm Ernst & Young LLP as auditors of the Eastern Regional Health Authority for the fiscal year ending 31st of March 2020.
Well, thank you, Peter. You've been a very active member of the Finance Committee, and we appreciate the challenges that you've dealt with over the past year and your report this morning. Before we continue our formal proceedings on our report, I'd like to just touch base with you on a number of highlights that reflect our activities for the past year. I want to speak to three items. One is innovation, some new technology and equipment that we have at the Health Science Center, and our energy and facility renewal program. At Eastern Health, we have diligently worked as a board with the organization to work on a culture of innovation, to stimulate innovative thinking and foster research. We are committed as an organization to work together with our provincial healthcare leaders, service providers, and academic partners to generate bold and ambitious ideas to find better solutions to transform healthcare in our province. In 2018, we hosted our first Health Innovation Fair in partnership with the Department of Health and Community Services, regional health authorities, the Newfoundland and Labrador Center of Health Information, the Newfoundland and Labrador Association of Technology Industries, and Memorial University. This fair brought together organizations and stakeholders to collaborate on the direction of future health innovations and to showcase some of the most significant initiatives undertaken in recent years at Eastern Health and across the province. Public exhibitions at this event included SurgeCon, an application that helps care providers address care during increased flow of patient admissions to the emergency department. Telehealth remote patient monitoring technology that connects clients and healthcare providers at distant site for health services. And MyCCath, a web-based solution for clinicians that facilitates the referral process for patients requiring cardiac catheterization laboratory services. All of which you can learn more about in our annual performance report. We are continuing to build on this momentum because we know the valuable role that innovation brings to the healthcare system, and the benefits are considerable. These benefits are not only realized by Eastern Health, but also all our partners, some of whom are here today. Most importantly, our patients, residents, and clients will benefit from advancements we make through innovation. We are also excited to say that along with the Healthcare Foundation and representatives from the provincial government, Eastern Health officially unveiled a new state-of-the-art MRI scanner at the Health Science Center. The new scanner helps guide the management and diagnosis for many illnesses, such as cancers, neurological conditions, as well as cardiac conditions. The benefits of having this type of MRI machine are numerous for both patients and healthcare professionals, including extreme efficiency, enhanced comfort for patients, and ultra-high definition imaging. This new scanner would not have been possible without the help of our partners, including the Healthcare Foundation, the Government of Newfoundland and Labrador, and Trades Newfoundland and Labrador. In the last year, Eastern Health also implemented its energy and facility renewal program. By upgrading and retrofitting identified facilities and equipment across the Eastern region, the program will help Eastern Health conserve energy, reduce rising utility costs, and decrease overall operational costs, while shrinking the organization's environmental footprint by lowering emissions. In addition to reducing operational costs, the program will decrease Eastern Health's annual greenhouse gas emissions by an estimated 3,300 metric tons. According to Environment Canada, this is equivalent to removing 1,121 cars from the road in the eastern region of Newfoundland and Labrador. The program also includes plans to recycle and remove dated, less efficient equipment from facilities and implement over 73 conservation measures across the eastern region by 2021, which will guarantee a reduction in Eastern Health's overall operational cost. Guaranteed to pay for itself within 20 years, the Energy and Facility Renewal Program will save Eastern Health nearly $1.8 million each year after the construction period, and is expected to slightly increase its saving each year thereafter. We are excited to be part of such an innovative and creative work, all of which help improve the care we provide. This is a brief snapshot of such innovative and creative work, all of which help to improve the care. We are delighted to share these ideas with you this morning, and building off the improvements that we have made as articulated by Ms. Hanrahan. It's a great story, and we encourage you to read our annual report and to come up to speed as to some of the other great innovations across the Eastern Health Network. I now call upon our President and CEO, David Diamond, to come forward and give us an overview of Eastern Health's performance over the last year. Would you please join me in welcoming David?
Thank you very much, Les. It's always a pleasure to come back home. This is home for me too, Heather, in Clarenville, and it's always a pleasure at these annual general meetings to provide a report of our performance over the last fiscal year. And this is in accordance with our strategic plan for 2017-2020, lighting the way and navigating together. And this past year marked the completion of our second year. Our cycle is a 3-year planning cycle. This year we're reporting on is the second of our 3-year cycle. And today is not only an opportunity to celebrate the achievements that we've experienced over this last fiscal year, but also gives me a chance to formally acknowledge the incredible successes of our talented team of physicians and staff and volunteers across the region and the province. You know, the achievements that you've heard about already, and I'll highlight some others in my talk this morning, all happen in an environment where our staff and our physicians and our management team are under incredible pressure with increasing demands and expectations. And, you know, our demand for acute care services over the last 5 years have increased by about 13%. In the last couple of years, our demand through the emergency departments have increased by 5%. And all in an environment where our fiscal resources are quite constrained. And so I want to say again, thank you to all 13,000 staff and managers and our 700 physicians for the tremendous work that you do to provide care and services to the people of this part of the province and the province every day. I'll begin by showing a short video that highlights some of our achievements over the past year related to our 5 strategic priorities. And if you go into our annual report, you'll know that our priorities are access, quality and safety, population health, healthy workplace, and sustainability. So as you can see from the video, we've been making good progress toward achieving our strategic goals, and we want to take a minute now this morning and reflect on some of those successes that stem from the hard work of everyone across this large organization. And I'll go into a little more detail on our performance in those 5 priority areas. And let me start with access. So improving access to care and services involves addressing not just wait times, but also some of the underlying reasons for long waits and barriers to seeing patients in a timely manner throughout our system. That can be in the community, in long-term care, or in acute care. Eastern Health continues to put a tremendous amount of effort in improving access to mental health and addiction services, as well as focusing on getting timely and accurate data on mental health wait times. Our priority is to help people get the services they need before they're in a crisis and to promote the prevention side of mental health and addictions. Some of the work done in this area includes expanding the Doorways single session walk-in services to 18 communities in our region. Some of you will have heard the tremendous work and the success that's happened on the Burin Peninsula, but that's being replicated throughout Eastern Health in 18 communities now on the Bonavista Peninsula, around the Clarenville area, and all through the Avalon. Increasing the number of therapeutic groups we've offered, continuing to review wait lists, and continuing to work on a strategy to address non-attended appointments with the implementation of telephone reminders. I'm pleased that as a result of our efforts, more patients are being seen sooner by select mental health and addiction services providers. in community clinics in this past year. We have essentially doubled the percentage of patients seen within our targeted timeframe from 25.8% in 2017-18 to 53.5% in 2018-19. Additionally, more patients are being seen sooner by child psychiatry, and we've seen an increase from 29.2% last year to 31.5% in this fiscal year. While the organization continues to explore and implement ways to improve on mental health and addiction services, we recognize that much more needs to be done, especially in the area of adult psychiatry, where despite our best efforts, we've not seen improvement in this past fiscal year. All of the improvements that we've made to increase access in mental health and addictions and to improve data quality aligns with the recommendation of the Provincial All-Party Committee on Mental Health and Addictions. We've also seen improvements in our alternate levels of care days and admissions for ambulatory care sensitive conditions, both of which are measures indicating access to the right intervention for the right client at the right place. Alternate level of care, or ALC, refers to patients who are in hospital even though they no longer need a hospital care. Beds occupied by these patients are not available to others who need hospital care and may indicate patients are not being cared for in the right setting. For instance, for some, that right setting might be at their home. Eastern Health has shown a downward trend in alternate level of care days in the past few years. We're happy to report that we've continued this trend and have further reduced the number of alternate level of care days to 9.6% in the last fiscal year. And this represents a 26.7% decrease from 2014-2015. Similarly, we also continue to decrease admissions for ambulatory sensitive conditions. Now, ambulatory sensitive conditions are specific chronic medical conditions such as diabetes and angina. When these conditions are treated effectively in the community, ideally they should not advance to hospitalization. Again, through due diligence, we've made improvements every year over the past 5 and have seen a 7% increase, a 7% improvement rather, since 2014-2015. In quality and safety, so quality and safety is also a priority for Eastern Health, and this is consistently woven throughout the entire organization. Eastern Health is committed to building a culture that encourages client and family-centered care. This approach to healthcare is one where we view people using health services as equal partners and ensures we are meeting their needs. We want to work in partnership with them to develop appropriate solutions to healthcare issues and ensure their values are reflected in clinical decisions. And one way we engage clients is through the Experience of Care survey. These surveys collect information from patients and clients and residents and sometimes family members on their perceptions of the services they've received. It also encourages respondents to rate their level of satisfaction with our services. We then use this information that we collect in this way to make improvements in program areas that are surveyed. During 2018-2019, the emergency department and the child and health department clinics were surveyed, and that data was analyzed, and I'm pleased that the percentage of respondents who positively rated their overall care was 77.7% and 93.3% respectively, and those are very encouraging numbers for us. We also use our Experience of Care survey to learn our clients' perspective on the cleanliness of our facilities, which has been very important for our board, I might say, and our board has been very involved in working with us as an executive team around the cleanliness of our buildings and how those buildings present. We continue to develop and implement and evaluate methods to produce cleaner, tidier, and well-maintained facilities, and I'm pleased that 84.3% of the respondents from the emergency department survey and 94.6% of the respondents from the child health clinic survey provided positive response with respect to the cleanliness of facilities. The Experience of Care surveys are ongoing, and we plan to reach out to all program areas over the next couple of years. So far, long-term care surveys have been administered, primary care survey tools have been developed, and planning for surveys in cancer care and mental health inpatient services are underway. Thirdly, population health. We've also made positive strides in population health, and we know that making a significant improvement in the health of our population is really a long-term vision. Change does not happen overnight. Eastern Health strives to provide the education and tools necessary to promote healthy lifestyles and to prevent illness early in life. Residents of Newfoundland and Labrador have challenges with respect to lifestyle practices, and our health indicators reflect this. If we want collectively to improve the health of our residents, we must chart a new course. Disease prevention is a major aspect of the work we do, and our one prevention program to highlight from the 2018-19 fiscal year is our colorectal screening program. This is a provincial program that Eastern Health oversees, and it targets individuals between the age of 50 and 74 who are at average risk for colorectal cancer. And I'm happy to report that the participation rate in our colorectal screening program over this fiscal year was 16%, which is over double what it was 3 years ago. Another success under population health is the rate of babies being exclusively breastfed until 6 months of age. Health Canada recommends that healthy full-term babies be exclusively breastfed for the first 6 months of life, as breast milk is the best food for optimal growth and healthy development. We're very pleased that our rate of babies being exclusively breastfed until 6 months of age has increased by 75% since 2014, 2015. Hats off to our public health nurses and our nurses in our child and women's health program who have helped us to make that happen. Despite the improvements in breastfeeding, we still have work to do related to healthy pre and postnatal care. And even with the tremendous work that's ongoing in this area, the rate of current smokers during pregnancy increased slightly from 11.8% in 2017-18 to 12.7% during the last fiscal year. And this increase highlights the need for the organization to continue to provide a focus in this area. The fourth of our pillars speaks to healthy workplace. And at Eastern Health, we value our people, the employees and physicians and volunteers who are dedicated to caring for our clients. Fostering a healthy workplace is, of course, one of our priorities. Indeed, we want to make sure that we promote health and wellness internally, and that we remind each other of the importance of staying healthy. Many of you are well aware that we are continuing to work on sick leave, which has been an area of focus for the organization over a number of years. At Eastern Health, we measure sick leave as the total sick leave hours per benefit full-time equivalent. And if you want to know what that means, you will see us afterwards, and I'll try my best to explain what that is. Total sick leave hours per FTE. And this means that we analyze the sick leave hours for each employee who is entitled to this benefit. This year, we saw a positive trend with sick leave going down from 152 hours in 2017-18 to 150 hours this year. To further illustrate the success of our sick leave reduction efforts, our sick leave rates were at 162 hours in 2014-15. In other words, each employee receiving benefits has decreased by an average of 12 hours per employee. I think you saw on the slide here about a 7.4% decrease over a 5-year period. Eastern Health will remain committed to prioritizing these indicators. If our employees are sick, this is a major impact on our organization and on our ability to provide care. Often intertwined in our sick leave usage is our challenge in increasing employee and physician engagement. This is not a unique challenge to Eastern Health, and many organizations are working to improve engagement. Eastern Health implemented the Aon Employee Engagement Survey in September 2018, and over 5,200 employees responded. Eastern Health saw a 4% increase in the percentage of employees reporting that they were engaged in 2018-19 in comparison to the last time this tool was administered in 15-16. I find that encouraging, that while recognizing that we must continue to focus on determining the underlying causes of our challenge with engagement, that we continue to improve in this area, and we will continue to be a priority for us in the future. Finally, in our five pillars is sustainability. Sustainability is our last priority, but not necessarily our least important priority. For Eastern Health to continue to improve in access and quality, safety, and health of the population, the organization has to be sustainable. And Eastern Health is always working to improve quality and effectiveness while at the same time reducing inefficiencies wherever we can. In partnership with Morrison Healthcare, a member of the Compass Canada group, Eastern Health continued to deliver meals in our acute care hospitals in St. John's via the Steamplicity model throughout 2018-19. Steamplicity eliminates waste in the system, provides a balanced and nutritious meals, and enhances the overall quality of services provided to patients, clients, and residents. Significant progress continued during 2018-19 to implement Steamplicity, including optimizing scheduling and completing a food waste audit across all sites. Steamplicity has realized approximately $1.5 million in savings in 2018-19. Patients and clients have also provided us positive feedback on Steamplicity. In patient satisfaction surveys for the first quarter of this year, all sites have maintained an 85 to 90% satisfaction rating. In closing, I would like to encourage you to read more about our many accomplishments outlined in our annual performance report, which can be found on our website. And thank you so much for taking the time and the interest to be here with us today. Thank you again to our dedicated employees and our physicians, our management group for their hard work in helping us reach these achievements. And we look forward to continuing to make further progress. The work's not all done, and there's still lots more to be done. And so we're looking forward to continuing to make progress in this third year of our 3-year strategic plan. Thank you very much, and Les, back to you.
Thank you very much, David. Really appreciate that summary. And we certainly want to publicly express our thanks to you and congratulations to you and your leadership team and the staff and across the organization for the great contribution they have made to improving healthcare in our region. I've been associated with a number of different sectors in our economy and over the last number of years and in socially generally in education and whatnot. And I became involved with healthcare just a few years ago. I don't think there's a more complex sector in our society than healthcare. Every day, there are new challenges. And not only for people ill and coming to look for services, seek release from pain, but think of the staff and the physicians and staff and people who work at healthcare who go to work every morning. I just don't mean hospitals, acute care, but I mean long-term care facilities and other personal care homes and on and on and on. And you think about the challenge that's before people every day. Very seldom is it a pleasant day, but our staff and people around you, they do their best to try to strive to improve the organization. But as I walk through and attend many meetings at the center, I walk through a lot of the clinics and I think about the people who are sitting there. They're not there for a good time. They're there to get help, to get assistance, and they are looking to people to really bring empathy and support and the best service they can to them. And I'm always astounded just to see the improvements that have been made across the organization, some of them that have been articulated here this morning. And as a board, we are very proud of the achievements that David and his organization have made this year. So I thank you very, very much for that. And we're going to open up for questions in a few moments. But in the meantime, I want to thank all of you for coming. And the business portion of the meeting is now adjourned. Thank you very, very much.